Hi, Dr. Bergum here, and I just wanted to talk a little bit about shoulder bursitis. Have you ever had shoulder pain and gone in to see your doctor or sports medicine doctor or orthopedic doctor complaining of shoulder pain, and they say, oh, I think you have shoulder bursitis. Let's just put a cortisone shot in there, you'll be fine. What I want to warn you about is most cases, probably 95% of the time, pain in the shoulder on the side here where the shoulder bursitis area is generally not a bursa problem at all. It's more of a problem with your rotator cuff tendon. And the bursa is an area, a thin layer of tissue that can sit underneath this bone called the acromion and under your deltoid muscles. Your deltoid muscles sit out here. So generally when clinics will say, we're going to do a bursa injection, they'll just basically feel the back of your shoulder and blindly inject into this area. So it is a small structure. So when clinics are doing blind injections in that area, most likely they're putting it right into your rotator cuff tendons or into the muscle. And that may help with pain, but steroids at the doses that are used routinely in clinics will actually cause degradation and weakening of those rotator cuff tendons and make you more prone to have a tear later. So let me show you an example of a real patient we just saw the other day who actually had some subacromial and subdeltoid bursitis. So this is an ultrasound image of a patient's shoulder, and this bright white area here is the bone of the humeral head, and this is one of her rotator cuff tendons, and this thin little strip here is a shoulder subacromial and subdeltoid bursa. This is the deltoid muscle. So just as a reference, the depth from the skin down to this bone here is about 1/3 of an inch. So then off to the side here, this is an image of a needle going in and doing an injection into that bursa. So that is a very skinny 27 gauge needle. You can see that that needle thickness is about as thick as the bursa itself. So again, the lesson here is do not let anyone blindly do an injection for shoulder bursitis. It's most likely rotator cuff tears, and if you have any conditions like this, give us a call. We can do a full evaluation and look at your shoulder and give you an accurate diagnosis of what's really causing your pain. So again, it's Dr. Bergum. Have a great day.